You are listening to the Lawyer Stories podcast with host Benny Gold. Lawyer Stories was founded in July 2017 and is an expanding global network of lawyers and law students sharing their personal journeys to the noble profession of the practice of law. Join us on this podcast as we dig deeper into these stories and hear from lawyers and law students from around the world in all areas of the legal profession. Here at Lawyer Stories, we believe that every lawyer has a story. What's yours?
Welcome to the Lawyer Stories podcast with Benny Gold. Today we welcome in Maria Santi, founder and managing partner at the health and medicine law firm, advocates for patients, physician-directed healthcare in Miami, Florida. How are you, Maria?
I'm doing good. Thank you for having me today.
Yeah, no, it's great to have you on. And I want to say on behalf of Lawyer Stories, thank you for your support. I know you've been a longtime follower, and it's really cool to see, your career go as it's going, which is pretty awesome. And just thanks for being a supporter of Lawyer Stories. We always appreciate that. So it's cool to finally connect and get you on here on a podcast.
I think it's a very cool organization.
Thank you very much. So give us a little background. I think you're a native Floridian, but why don't you tell us for sure?
Yes, so I am a native Floridian, born and raised in Miami. Been here my whole life. And as far as backgrounds, what got me to this point of becoming a lawyer? So since I was 9, I wanted to be a doctor, and I actually started pre-med courses. But my life path kind of changed because I got married very young. I had my son at 19, and then I kind of shifted my studies. But I had worked with a pediatrician when I was in high school, so I did a lot of insurance and medical billing. And ultimately, I went through college, studied psychology, and I was more focused on my family. But ultimately, I ended up getting a divorce, and that took me into the paralegal route.
Okay.
And then at that point, I decided, okay, well, I want to go to law school because I have 3 boys. I was a single mom with, a working single mom. And I was like, I want to give my boys a better life.
Yep.
And that's what I did. And I decided to go to law school. And then they had a health law concentration at the time that I was going. So I enrolled in that. And I said, I can do the best of both worlds, do medicine, which I've always wanted since I was a little girl, and mix it with law. And now here I am fighting to get people treatment and medicine when insurance companies deny it, or helping them with patient rights issues.
Yeah, no, it's an amazing journey that you took, and I actually want to go back and break it down a little bit. I think that was like a great summary, and what you've done is like very noble and like just furthering yourself and your education and going deeper and deeper in life. So like what you did kind of say this, but what can you just pinpoint like the exact time you said to yourself, I want to be a lawyer?
So I would say it was during the time I was a paralegal, because like I said, I wanted to be a doctor first, but then I'm like, I'm going to focus on my family because this pre-med stuff is really hard.
Right.
And then I became a teacher for a little bit it was the perfect mom job. And then I said, well, I went through a divorce actually. And then that's where I was like, oh my gosh, I don't make very much as a teacher. I need to make more money, even though their dad was very involved. But I'm like,
Right.
I have to make more money. So I was like, what do I do? And then that's where I became a paralegal, was a paralegal for about 8 to 10, I think it was 9 to 10 years. And then that was the point where I said, you know what, if I want to go to the next level, I need to go to law school. And I
Right.
just decided, hey, I'm just gonna go to law school. I didn't know how, or how I was going to be able to do it, but it all worked out with the support that I had, and I'm really glad that I did it.
Yeah, so Maria, it all seemed very sequential. Just to like break that down a little more, you went to FIU in Florida,
Yes, for undergrad, yes.
undergrad, right? So, and then you got a paralegal certificate at the University of
Yes.
Miami, like what is it, 5 years later,
Yes,
right?
exactly.
Yeah, there you go. All right, the U. All right. For those of you watching on YouTube, we're doing the U right now. We're actually listening. We're doing the U. If you're watching it, you can see us. Anyway, so excuse me. 5 years later, after the paralegal certificate, you went to Nova. Nova's, we've definitely spoken to people from FIU, Nova. So that it seemed very like systematic the way that you went in these like 5 year increments to get to the lawyer uh, to get to the lawyer status. Is there anything more about that? Like, was that something that you sort of planned, or is it just kind of coincident that it was like 5 years apart?
I think that was a coincidence. I
Okay,
didn't even realize that until you mentioned it.
nice,
So yeah, it's probably a coincidence.
nice. Okay, do you feel that being a paralegal helped you in law school, and how so?
Um, well, yes, most definitely. I think it helped, but it also hindered a few things.
Okay,
It helped because I knew the practical aspects of the law and what really mattered in what I was studying, but it didn't help as far as like when you go to law school, you have to think about the philosophy of the law and how everything interconnects and kind of like, it depends. That's always the answer. And you have to look at all these
right.
different things. And as a paralegal, I was so like detail oriented that I would like look too much into little details sometimes that really didn't make a difference or didn't matter as to the outcome. So that was a little bit of a struggle, but definitely like it helped me as far as like the practical aspect after I finished law school and maybe doing assignments throughout law school. Like I was like, I already knew a lot of things that it was like second nature to me.
Yeah, that's awesome. And you had some work experience, and how about that aspect? I mean, I always kind of thought I had took a year off before law school, but I kind of thought maybe if I had a little more time off, it would have helped me sort of with time
True.
management and that sort of thing. Did you see it different there? You were already probably working like an 8 to 5 job, and so it might have been easier to like set up your schedule. I don't know. I'm curious.
Well, so I mean, as you know, I was a single mom of three boys, so
Right.
I
So
was
you had kids.
juggling.
I
I
thought
had
of that
three
after I just
kids.
asked the question. Right.
Single mom, yeah. And yes, I was working full time when I first started law school. I started the part-time program, but I did find that it was a little challenging and I'm like, if I'm going to be successful, I need to do something. And I did switch to part-time work and full-time school, but I was still working. But I would say I kept working because I mean, I had a family to support. So it's not like I could just be like, oh, I'm not going to work.
Yeah. Yeah. No.
So
Well, totally. Yeah. It's
it wasn't really it wasn't really an option because I had my three boys that
and
I
you,
had to care for.
and you have great litigation experience. I mean, leading up to after you graduate law school, you have a lot of obviously prior experience doing being a paralegal, and you also had something that I found pretty interesting. If you want to just touch on this, or I don't know how much you want to share about it, but you were the founder and director of Children First Foundation USA. Can you just tell us what that is?
So that's a nonprofit organization that I started. I'm no longer doing it, but that was actually inspired from me becoming a single mom. I started a nonprofit. It was Wings for the Single Mom first, and then I changed it to Children First, where the idea was to allow moms and their kids to be able to enjoy cultural arts, cultural events, maybe some travel events, and just like kind of shift the purpose of survival to actually creating something in their lives that's going to enrich their lives. So that's where that came from. It
Wow.
sprouted from me as a single mom wanting to give back to the community and just because what I went through, I'm like, wow, I'm just like working. There's got to be more. So that, yeah, we did a lot of nice events, but that's where
So
that came
you
from.
so you had event like you created events for with single mom like for
Yes.
kids, and that's incredible. Okay.
Yeah.
Do,
But it would be focused like on museums or
yep.
like art related, anything cultural aspect.
Okay. Really neat. So moving on to sort of like present time, we all know obviously your work ethic is next to none, unbelievable. You've dealt with some adversity, but you were able to keep up with it, get through law school. Like, tell us why health and medicine law.
So, okay, this is gonna make me cry a little because it has to do with a little bit with my grandma. But it does have to do with the fact that I wanted to be a pediatrician since I was 9. And then ever since I worked with a doctor, my whole family friends would always call me, what do I do with this bill? What do I do with this insurance issue? Because I learned that while I was working with that doctor. And then even throughout law school, like I'm in law school, I graduated law school. I was working at a firm and I would still be getting calls from family and friends. And I realized, you know what? There's a need for this. I don't see the need as being filled. I was doing insurance defense at a law firm and it wasn't really fulfilling for me. And I just thought, well, you know what? This need is still there. And maybe I can just create something to fill this need. And I think the impetus of that was when my grandmother, this is like, it's gonna make me want to cry because she already passed away, but
Yeah.
she needed this eye surgery and she was part of this Medicare center that said, no, you have to do it here. But they said, the doctors were like, Baskin Palmer is the only place that has the machine that can provide this surgery. So it has to be there. They didn't want to approve it. So I fought for her until she could get this approved at Baskin Palmer. And the follow-up, same thing. They didn't want to let her do the follow-up there. And I fought for her. And she was able to get it. And then she's like, why? How did you do this? Like, please tell me. I'm going to tell everybody so you can help everyone. So I think at that point, I was like, oh my God, look how many people are out there without voices, like my grandma, that don't have anyone to help them. So then
Yeah.
I said, you know what? I'm going to just start my own firm. And that's what I did. Like it just,
Amazing.
I took the leap. It was hard because, like I said, it wasn't very fulfilling. I worked with great people, but I'm like, this is not fulfilling work. And for me, it's important to make a difference in the community and in life.
Right.
So I just said, I'm gonna do it, and boom. And I just said, okay, that's exactly what it is. Health and medicine issues, and here I go. And that's where
Yeah.
that came from.
Well, congratulations. I mean, that's not easy stuff, dealing with insurance companies and doing the appeals and,
No,
so what's that?
no, it's not. That's what I was saying.
Right.
It's, but I love
So,
it.
yeah. So what are some of the big current issues and topics that you're dealing with at the firm?
So I would say a lot of what I'm seeing right now, um, unfortunately, AI is affecting this area because I don't know if you've seen it, but there was an article that recently came out on some insurance companies that they're denying hundreds or even thousands of claims with the push of a button, not even
Wow,
needing the
AI. Okay, that's important. So
patient.
I mean, it's all important, but that's crazy is that you were talking about AI already with this. I mean, who would have thought? So these people are just denying, and I haven't even let you finish your sentence yet. But AI, they're literally like pressing a button and they're denying, like they'll be like, deny this claim, blah, blah, blah. And then,
Exactly. Like a certain algorithm will come up and they don't even read the patient records or the patient file. So, like, if a doctor, which is actually a doctor, has clinically assessed the patient, has seen this patient, knows their condition, says they need this, the insurance company will use this AI algorithm to say it's denied, even though the person really needs it. So that is where I'm seeing like there's some denials that just don't make sense, and I feel like that's a problem that I'm seeing consistently, and it's growing. So
they don't make sense because they're not accurate as according to what they're trying to get, or they're not.
right.
Yeah, okay.
Right. Like it might be, they just match certain things up that would make it an exclusion under the policy, or just because it has some words, they're going to be like abdominal or gastric bypass, for example, is a big thing. So those words, like I see a lot of patterns of denials for that. And it's not necessarily cosmetic all the time, but just because it has the words, they will deny it. Or just things like that, that they just put it into a box, and it doesn't necessarily mean that, like they don't even look at the patient, and that's a problem.
So when you look at these things, have you cracked the code? Like, when it's an AI decision or an AI denial, rather?
Yes, in some cases, yes, because I keep seeing a pattern. And it's the same thing after I've done an appeal and provided all the medical records already. Now they come back and deny it for the same thing. So I'm like, that doesn't make sense. And it's like I truly believe in, physician directed healthcare. Like doctors
Yeah.
went to medical school, doctors sacrificed a lot to become doctors, and we need to listen to them, not an insurance company that's punching in like numbers or codes to get some kind of approval of a service.
So could this lead, do you think, to greater negligence issues like malpractice? I mean, if this is something that they're like trying to, if they're writing these things and they're not even accurate and they're way off and based on like an algorithm and certain words, I mean, that's going to cause some trouble, I would think.
Yeah, it usually does, and like a lot of times it ends up in a lawsuit because of that, but the doctors really can't be held responsible for that. And I know that there's some advocacy going on with the American Medical Association, and there's one particular doctor I follow, I can't think of his name right now, that basically goes into that and tells us about the coding. Like there's a lot of coding in medicine as to billing for services, that they need to put in a code saying that you have to put in, like, if there was a delay because you didn't approve it, there should be a code for that to
Yep.
make them accountable to see how much time is getting spent on that. And that doesn't exist, and they haven't wanted to do something like that, but um that's something that needs to be looked at, because like what you're saying, it could lead to negligence, but it's not the doctor's fault. And if the patient doesn't have money to pay for this, what can they do?
Wow,
Kind of
it's going to
sad.
cause some, that's going to be another issue, the forefront. I mean, it already is. How long has this been going on with the AI?
Mm, I would say I've seen it like probably increasing in the past year, maybe a
Okay.
little less than a year,
Okay.
because I've seen other denials. Obviously, I've been doing this already, just completely dedicated to this for 5 years, a little bit over 5 years, maybe six. I don't even remember right now, but
Yeah.
I didn't see it as bad as I do now with like so many denials. I just don't get it. Like
Wow.
why? Yeah.
So we all know like insurance is difficult to even when you're an employee and you're navigating through this and that, and and even a patient. Like so, excuse me, could you give us some advice to how to like navigate an insurance issue?
An insurance issue. Well, I mean, there's a lot of steps to this, but I think the most important thing, and part of why I do what I do, is that I think collaboration between patients and doctors is very important. So if there is an insurance issue, the first thing to do is get your doctor involved, because they're the ones that are directing your care. They're the ones that saying this is what you need. And just kind of advising them and telling them, look, I'm having this issue. And then dealing with the appeals process with insurance and just trying to get it resolved at that point with the collaboration of the doctor, obviously. And other than that, like you you can reach out to, like, if it you have to escalate it to like the insurance commissioner in your state or something like that. But I think it's worth a shot with the appeals process. It's not always something that you can do because it might be an urgent situation,
Right.
but I think definitely the most important thing is getting collaboration with the doctor, reviewing your policy documents, calling, a lawyer such as myself that understands these issues wherever you are, to try to assist you if it gets to that. Hopefully, it wouldn't. But the main thing, yeah, collaboration with the doctor.
Great. I love that advice. Do you have any advice for someone having an issue with medical billing?
Medical billing, yes. So for that issue, there's a lot of laws that people don't know about that protect patient rights. So we have seen a lot of movement in Congress with issues. The No Surprises Act is one that came out. So once you get a bill, the first thing to do is request an itemized bill and request an audit of the medical bill, because a lot of times there's errors in the codes, or something that was double billed, things like that. And then usually if you request an audit, the hospital will
Oh, nice.
do that, and
Okay.
they will patch their own errors. So just in simple terms, that would be like a good step. And then if they don't want to resolve it, then try to get a cease and desist letter sent so that they don't continue to collect, and try to resolve the issues.
I think that's great advice. And of course, call Maria in South Florida and she'll help you out right away.
Oh,
Um,
for sure. And I'm always happy to talk and try to help people, and talk with other lawyers as well.
that's great. That's great advice because I think these things are really prevalent amongst a lot of people. No matter income, whatever it is, like you get these hospital bills sometimes, and it's kind of hard to figure them out. I think insurance is just a very difficult item, so we need people like you to help us through this. So Maria, tell us the type of clients that are coming to you. Not, excuse me, not the type of clients, but who are your clients, basically?
So I have mostly I'll have people that are patients. I mean, a lot of us end up becoming patients at some point in our lives. So patients that are having issues with their insurance, that claims are getting denied, or people who have had their patient rights violated, either improper disclosure of medical records or other issues. If they get treated at some mental health or substance abuse facility, there can be patient rights violations there. And also, I do have also some physicians that I represent against insurance when they underpay health claims. And
Really? That's interesting.
yes.
Is that happening more and more, underpaid health claims?
Yes, yes.
Uh,
I think it is based on especially based on the way the laws are crafted these days. Yes, it is happening a lot because the health insurance companies are like these big conglomerates, and they're basically just trying to set rates without considering the doctors. Again, I think the doctors are very important. They deserve to get paid for their sacrifices and for the people that they help. Um, so I think, yeah, that's something I do. And then, sometimes I may have like a small health plan or some organization that needs my advice on some healthcare related issues.
that's great.
But I would say the majority is, regular people that or doctors that are trying to deal with all these insurance issues.
Okay, good. So your website says with health and medicine law firm, you get more than professional legal representation. We focus on your vision, opportunities, issues, and challenges.
Yes.
So what do we mean by that over there?
What do I mean by that? What I mean by that is that, so if somebody comes to me for a problem that they have or a possible case, I need to talk to that person and understand what their goals are. It's not necessarily okay, so I have the legal knowledge and I may have a certain game plan, but I need to understand their own like aspirations and goals and whatever the situation is. It's not just about me and my knowledge, because my solution may not necessarily be the solution that they want. So it is very important to assess, either if it's a business or an individual, like what are your goals? What do you feel right doing? Because some people, for example, may not want to sue their insurance company. So they might say, okay, well, do an appeal or try to resolve it or try everything. And other people are just like, well, no, be very aggressive. So that's not my call. That depends on my client and also their values and who they are as a person. Because I like it's like I said, it's not just what I see. It's the whole thing, the whole being, the whole person, and what they would like to accomplish with my help.
It's great. Love it. So what advice do you have for someone who may want to enter this area of law?
What advice? I would say that you have to be open and flexible and really study details. Like if you are interested in healthcare, you need to know the foundation of administrative law. You need to know the foundation of, just like the fundamental aspects of the law, maybe even constitutional law, maybe not so much constitutional, but definitely administrative law, and just learn how to distinguish between certain things because it's an area of the law that is constantly changing. And it's, I don't know what the word that I'm trying to use is, but um I don't know. It's like no case that I have is the same, right? Because
Yeah.
every single case you're going to have in health insurance, for example, there's like all these types of policies. There's state, there's federal laws. Like you need to know state and federal law. You need to know how all of that works together because you may have a case, like for example, I have done Medicaid and Medicare cases. Medicaid, when I help little kids that need treatment, for example, I'm super passionate about that.
Right.
So there it's like you're at Medicaid level, which is administrative state, but then it has federal law that comes into it. So you have to know your state, you have to know the administrative law, and then you got to mix it in with the federal law. So it's like you got to know all the steps.
Got
It's
it. All right.
not
It's
just,
a lot. I think it's
yeah,
complicated, so it's a lot. I get
yeah,
you. I get
yeah.
it. So where do you see the firm in 5 to 10 years?
In 5 to 10 years,
Yeah.
I would definitely see the firm. I would see it as a household name as far as
Nice.
solutions in healthcare for regular people. Ultimately, I would like to expand to other states to be able to fill the need because I think there is a need. So in 5 to 10 years, I see us as an advocate, not only for like people with insurance, but for Medicaid and Medicare, people that don't have anyone to help them. Just as, you know, as a guide and holding health insurance companies and government organizations accountable when they don't want to provide health care and serve as an impediment to people that actually really need these services.
That's great. And speaking of that, like, how do you feel you and your firm you're making an impact, a positive impact on the healthcare industry?
So I think what we're doing is the positive impact is we're bringing humanity back into the picture because like I mentioned before, health insurance companies see boxes. Well, a human being is not a box,
Yep.
and a doctor needs to look at a patient and there's humanity there. So I
Right.
think that's one positive impact, and also giving people their voices, like patients, giving patients a voice in the healthcare industry, but realizing again the collaboration with doctors is so important, and you gotta work together. So I think that is a positive impact, and also showing the health insurance companies and other organizations, well, you know, we're not going to back down. Like you are a conglomerate, but you also have to have the human component because that's why you exist, because of the humanity that exists that needs your services. So
Yeah.
that's
That's,
yeah.
that's great. I love that. Is there anything else for the Lawyer Stories community? Do you have any like advice or anything that we missed that you might want to touch upon? Um, I know we went through a lot of stuff. I
Mhm.
love your story. Is there anything else you want to tell us about health and medicine law firm?
Mm. Well, I think as far as for lawyers, what I would say is I feel like a lot of lawyers get pigeonholed into a certain area. I would say that keep your mind open and actually believe in your passion and why you went to law school, and don't give up on that. For some people, it might just be okay, I just want to make money and you don't really care. Other people, it's you wanted to help people. Others, you know, you have a certain vision, and I would say don't think it's impossible. Like just go for it and you can make it happen. And I don't, what else other than that, as far as the health and medicine law firm, I just want to say, I mean, we're there to make a difference and help others, and I'm always open to listening to people's stories and seeing how we can help.
That's awesome. How'd you get such a cool name for your law firm too? Like it's so like just huge. Like it's very I don't know. It's a very big time name, health and medicine law firm in Miami. Like that's pretty cool. You just signed up for it.
Yeah, it just occurred to me. I'm a big believer in sitting for ideas, as Napoleon Hill is one of the books. I read his books. If you read his books, it talks about sitting for ideas, and it came to me, and I was like, oh, that's in simple terms, that's what I'm gonna do. Health and medicine law and help people. And that's where it came from. That's
That's
it.
awesome. Love it. Well, hey, congrats on all your success. And, thanks for coming on the show. If there's anybody you ever see on Lawyer Stories that you want to be connected with, that you think will be good synergy, good connection for you, I'm more than happy to make the warm introduction. That's sort of what we're doing in Lawyer Stories Connect, which we hope to launch. I've been saying this for every couple months now, but we hope to launch that in 2 to 3 months. So it would be our pleasure to introduce you to anybody that we know that might benefit you, or you might benefit each other. And congrats.
Thank
And
you.
you're welcome. Stay right there. Everybody, thanks for tuning in. And wherever you are in the world today, enjoy yourselves. Cheers.